The Treatment Action Campaign, the TAC, has welcomed the Competition Commission's decision to investigate collusion among companies that sell cancer medication. Now, the TAC says the investigation is a major victory in the struggle to ensure that all people in South Africa can access the medicines that they need to stay healthy and alive. Earlier this year, the TAC launched the Tobeka Daki Campaign for access to Trastuzumab, which is a or a monoclonal antibody that is used to treat breast cancer patients during a global day of action. Now, the campaign was named after Tobeka Daki, who was a cancer activist who died of breast cancer in November 2016. Now, to talk to us about this and this story, we're joined by Salome Meyer. She is with the Cancer Alliance Tobeka Daki Campaign. Salome, a very good morning to you and welcome.
Thank you very much, and to the listeners and viewers, good morning to you.
Mrs. Meyer, this sounds like a very tragic story. Tell us about the Tobeka Daki story.
Tobeka Daki was a HER2 positive breast cancer patient, and she came from Mdantsane in East London. In 2014, she was diagnosed with this breast cancer, and at the time when she was diagnosed, she accessed the private health care. The cost of Trastuzumab, or Herceptin as it is commonly known, is about 500,000 Rand for a year cycle of treatment. Her medical aid, however, turned her down and denied her access. She became quite ill, and because of the cancer treatment, she actually lost her job. She then had to access the public health service. And Trastuzumab is not available commonly in the public sector, again due to cost, because there is no ways that the government can afford the private sector price of 500,000 Rand, or even the negotiated price of 1,212,000 Rand for the year. So Tobeka died within 2 years. And the sad part of it is that she was offered the treatment, therefore she was a candidate for a life-saving treatment. Life-saving treatment. Trastuzumab is also on the WHO list as an essential medicine. However, in South Africa, it is not listed as an essential medicine, again, due to cost. So we of the Fix the Patent Law campaign and coalition are asking the questions. Is this fair? Is this basic human right?
So, what do you then make of the Competition Commission's decision to investigate collusion among drug companies that sell these particular drug medication?
Well, we welcome the probe of the Competition Commission and say that it is high time in South Africa that the focus is on the high price of cancer medicine. Cancer is a treatable disease, and cancer treatment should not be available only for the selected few in the private sector whose medical aid will be willing to pay the exorbitant prices. We need to look at the situation also where 84% of this country's population access public health. There is no ways that the government can afford these high prices that the companies are charging us.
Do you then think, Mrs. Meyer, that there should be much more regulation in order to regulate the drug sector for that matter? Because it seems there's a disconnect between pricing in the private and even the public sector.
Absolutely. There needs to be an overhaul of the system. We have a health system that is crippled. That is number one. So we also need to look at the regulatory aspect from the Department of Health in terms of prices, what would be the prices and what would be affordable prices for specifically cancer medication, but not only just cancer medication. We're talking about all treatments. But what we definitely need in this country, and South Africa is a signatory to that, is we do need an overhaul of the patent law system in South Africa. The TRIPS flexibilities allow this country to actually do what is required. And we have asked for that as the Fix the Patent Law Coalition, that we need to overhaul that system. But that is a law that falls between three departments. So we're talking about the Department of Trade and Industry on the one side. Then we're talking about the Department of Health, who does support us in this call to overhaul the system. And then on the other hand, you have the Department of Science and Technology, who manages the offices. So there needs to be a collaboration between the three departments to make sure that people get access to treatment in this country.
Will that not perhaps impact on free market enterprise and competition?
Free market enterprise is something that we throw into people's faces as a norm. But we need to go and look and see what is it that we need to make sure that in line with the constitution of this country, that we also have access to treatment. And I think that is what we need to look at in terms of these investigations when we're talking about the Competitions Commission as well as the patent law system that needs to be adjusted.
What role can the Medicines and Related Substance Control Amendment Act play in reducing the cost of medication in this country, Ms. Meyer?
The Medicines Control Council is the regulatory body that looks at the whole system of allowing for medications. But again, that happens against the background of the patent law. Currently, we do not have a system in South Africa where our patents, and then we are particularly talking about patents as it relates to medicines. We do not have a system where patents are examined. So therefore, any company can come in and slap on another patent, and which is called patent evergreening. And when you wake up again tomorrow morning, there will be another patent, as in the case with Trastuzumab, the patent only expires 2033. So that technically will not allow another company to bring a biosimilar onto the market. Now, that is particularly where the overall of the system also with regards to access to medicine and the Medicines Control Council need to come in and play their role. So we need to look at that system that needs to be overhauled as well.
Ms. Meyer, thank you so much, and thank you for joining us in our parliamentary studios.
Thank you kindly.
Now that was the Salome Meyer. She is with the Cancer Alliance talking to us about the Tobeka Daki Campaign for access to that drug, and of course the Competition Commission who is investigating after the break. Of course, we'll also be talking to some more people around this after 10 o'clock. But right